Maintaining appropriate testosterone levels is vital for general well-being for both men and women. However, testosterone levels normally fall with aging. This deterioration might lead to different health risks if not managed effectively. The core of the issue cardiovascular health revealed. Cardiovascular health refers to the health of your heart and blood arteries. It includes a variety of elements. These include blood pressure, cholesterol levels, and cardiac function. Good cardiovascular health is crucial for overall health and lifespan. Your heart operates as a pump. It pumps blood throughout your body. This blood supplies oxygen and nourishment to your organs and tissues. Healthy blood vessels support smooth blood flow. They also assist manage blood pressure. When cardiovascular health is damaged, it may lead to significant diseases. These problems include heart attack, stroke, and heart failure. Maintaining excellent cardiovascular health demands a many-pronged strategy. The testosterone heart health link unraveling the connection. Recent research reveals a tight association between testosterone levels and cardiovascular health. Studies have revealed that both low and high levels of testosterone might have ramifications for heart health. The specific methods by which testosterone affects the heart are complicated and currently being investigated. Some research imply that testosterone may have a direct influence on blood vessels. It may help relax and dilate blood arteries. This in turn may enhance blood flow and reduce blood pressure. Furthermore, testosterone may have a function in controlling cholesterol levels. However, some studies have found a probable association between high testosterone levels and an increased risk of blood clots. This underlines the intricacy of the link between testosterone and cardiovascular health. More study is required to properly comprehend this complicated link. Testosterone's protective barrier, benefits for your heart. When testosterone levels are within a healthy range, it may provide various advantages for cardiovascular health. As discussed previously, testosterone's tendency to relax blood arteries may enhance blood flow and lessen pressure on the heart. Moreover, testosterone may assist reduce cholesterol levels by lowering LDL cholesterol, frequently referred to as bad cholesterol. High levels of LDL cholesterol may lead to plaque development in arteries, increasing the risk of heart disease. By possibly reducing LDL cholesterol, testosterone may help to a better lipid profile. Additionally, testosterone has a function in controlling insulin sensitivity. Insulin is a hormone that helps your body utilize glucose for energy. Insulin resistance, a condition where your body doesn't react properly to insulin, is a key risk factor for heart disease. Some studies show that testosterone may enhance insulin sensitivity, possibly lowering the risk of cardiovascular issues. Section 5. When testosterone goes astray, risks to heart health. While regulated testosterone levels might be helpful for the heart, both low and excessive amounts can offer hazards to cardiovascular health. Low testosterone levels have been related to an increased risk of metabolic syndrome. This syndrome is a collection of illnesses. These include elevated blood pressure, excessive blood sugar, extra abdominal fat, and abnormal cholesterol levels. Metabolic syndrome dramatically raises the risk of heart disease, stroke, and type 2 diabetes. Therefore, correcting low testosterone levels may be key in reducing these risks. On the other hand, overly high testosterone levels, commonly found with anabolic steroid usage, may also be hazardous to heart health. High testosterone levels might lead to an increase in red blood cell formation. This may thicken the blood, making it more prone to clotting. Blood clots may obstruct blood flow to the heart or brain, resulting in a heart attack or stroke. Therefore, keeping testosterone levels within a reasonable range is crucial for good cardiovascular health. Section 6. Testosterone therapy, a balancing act for the heart. Testosterone therapy is a medical treatment that includes boosting testosterone levels. It is often administered to males with clinically documented low testosterone levels, commonly known as hypogonadism. While testosterone treatment may provide various advantages, including better energy levels, mood, and sexual performance, its influence on cardiovascular health is complicated and needs careful study. Some studies have suggested that testosterone treatment in men with hypogonadism may enhance some aspects of cardiovascular health. For instance, it may lead to improvements in blood vessel function and decreases in LDL cholesterol. However, other research have highlighted concerns regarding possible dangers. Some data shows that testosterone treatment may be connected with an increased risk of blood clots, especially in elderly men or those with pre-existing cardiac issues. Therefore, the choice to commence testosterone treatment should be decided on an individual basis, carefully balancing the possible advantages and hazards. Section 7. Age, testosterone, and cardiac risks are a complicated interaction. As men age, testosterone levels normally fall. This deterioration is slow, commencing in their 30s and continuing throughout their lifetimes. While this loss is a natural aspect of aging, it may lead to an increased risk of cardiovascular issues. As testosterone levels decline, males may suffer an increase in body fat, especially around the belly. This form of fat, known as visceral fat, is especially hazardous to heart health since it releases inflammatory compounds into the circulation. Furthermore, age-related testosterone reduction might lead to a decrease in muscle mass and bone density, further raising the chance of cardiac issues. Moreover, older men are already more prone to cardiovascular illness owing to other age-related variables such as hardening of the arteries and a reduction in heart muscle function. Therefore, it's vital for men to be proactive in maintaining their cardiovascular health as they age, and addressing low testosterone levels may be a component of that plan. Section 8, Lifestyle Choices, Boosting Testosterone and Heart Health Naturally. Making healthy lifestyle choices may significantly benefit both testosterone levels and cardiovascular health. Engaging in regular physical exercise is vital. Exercise, especially strength training, may raise testosterone production and improve heart health. Maintaining a healthy weight is equally vital. Obesity is related to reduced testosterone levels and an increased risk of heart disease. A balanced diet rich in fruits, vegetables, lean protein, and whole grains is vital for maintaining hormonal balance and cardiovascular well-being. Getting proper sleep is also vital. Sleep deprivation may affect hormone synthesis, including testosterone. Chronic stress may also significantly affect testosterone levels and raise the risk of cardiac disease. Incorporating stress-lowering strategies such as yoga, meditation, or spending time in nature might be useful. Section 9. Recognizing the signs. When to seek medical advice, it's crucial to be aware of the signs and symptoms of both low testosterone and cardiovascular issues. If you feel chronic lethargy, reduced libido, erectile dysfunction, increased body fat, depressed mood, or problems focusing, it's vital to visit your doctor. These might be indicators of low testosterone. Similarly, if you develop chest discomfort, shortness of breath, irregular heartbeat, dizziness, pain spreading to the arm or jaw, nausea, perspiration, or exhaustion, get emergency medical assistance. These are probable indications of a heart attack. Early identification and therapy are critical for both low testosterone and cardiovascular disease. Your doctor may analyze your symptoms, do required tests, and prescribe suitable treatment choices. 10 potential perspectives, unresolved questions, and current research. While we've made considerable gains in understanding the link between testosterone and cardiovascular health, there are still many unsolved concerns. More study is required to completely unravel the complicated pathways by which testosterone affects the heart. We need to determine the optimal testosterone levels for cardiovascular health at different ages and in individuals with varying health conditions. Long-term studies on the effects of testosterone therapy on heart health are crucial, particularly in older men and those with pre-existing heart conditions. Further study is also required to examine possible tailored ways to testosterone therapy, examining individual risk factors, and customizing treatment schedules appropriately. By addressing these study gaps, we may acquire a clearer knowledge of the complicated connection between testosterone and cardiovascular health, leading to more effective preventative and treatment options. Section 11, in conclusion, emphasizing your testosterone and heart health. The complicated relationship between testosterone and cardiovascular health underlines the necessity of a comprehensive approach to men's health. Maintaining normal testosterone levels throughout life is vital for general wellness, including heart health. By adopting a healthy lifestyle, being aware of the signs and symptoms, and obtaining prompt medical guidance, men may take proactive actions to preserve their hearts and live longer, healthier lives. Continued study in this subject promises to further explain this complicated link, leading to more focused and effective therapies for enhancing men's health.
Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.